Cholera outbreak is currently ravaging some parts of Nigeria, including Lagos, the state known as Center of Excellence. Laboratory investigations and test results confirmed that the current outbreak is associated with cholera type known as Serover 01. The identified cholera strain is aggressive and highly contagious, with a potent variation for widespread, especially with the aid of rainy season. Galaxy News correspondent Lebby Joseph has more in this report. Gastroenteritis, also known as stomach flu, is an infection that causes inflammation in the stomach and intestines. This virus is currently ravenous in many communities across Nigeria. Record shows that over 400 cases of severe gastroenteritis caused by cholera were recorded across local government areas of Lagos State, and many of these cases resulted to death. The Nigerian Center for Disease Control and Prevention recently reported that Nigeria has recorded over 65 confirmed cases of cholera, with more than 30 deaths from 1st of January to date across 96 local governments in 30 states.
When we observe the outbreak, it's a notifiable disease, and the step in epidemiology in cases like this, one, state disease notification officer was alerted, the Kosofe local government MIE was alerted, and we galvanized into action. We throw our facility open to people to come in. Those that we handled. But unfortunately, they brought in about 5 BID cases that brought in dead. Those are the mortality that happened outside the precinct of this hospital. But as for the cases that came in, we did not record any mortality. They all recovered in record time.
At first, we didn't know it was cholera because most of the time patient presents to the hospital with normal symptoms of diarrhea, which is indicative of gastroenteritis. So some other times they could have vomiting as well, and we manage them as the normal gastroenteritis. So up until we take samples and run lab tests, then we'll be able to know the particular cause of the issue at the time. So when they came in, we had the first case. We felt it was the usual gastroenteritis, but before we know it, we started seeing series of cases, and in about a span of 12 hours, we were able to record several cases. Then we know there's a problem going on.
Cholera disease is caused by ingestion of food or water contaminated with the bacterium Vibrio cholerae. Cholera means a global threat to public health and an indicator of inequity and lack of social development. Cholera can cause severe diarrhea and dehydration and can kill within hours if left untreated. Most of the cases in Lagos have been linked to intake of contaminated tiger nut drinks, which lead to hospitalization and death.
It's a disease that entered into the host via the mouth. That's how we call it fecal-oral routes, and this could be traceable to contaminated water, contaminated foodstuff, and so on. Of course, then contamination of edible food with sewage water in what is popularly known as gutter water. This could be an offshoot of the outbreak. However, epidemiology have already hit the ground to find out what must have really led to this gargantuan outbreak.
It's an outbreak, it's an epidemic in this part of the world today, and it's a waterborne disease that actually manifests as diarrhea, that is watery stool. Sometimes it can be so severe that it actually leads to cardiovascular collapse. It leads to stroke and severe dehydration, which could actually kill the person affected.
According to WHO, there are many serogroups of Vibrio cholera, but only 2, that is 01 and 0139, lead to outbreaks. A serogroup refers to a group of serovars that share common antigens. Every year, an estimated 1.3 to 4 million people worldwide get cholera, and between 21,000 to 143,000 people die, according to the Center for Disease Control and Prevention.
Any food or water that is boiled or cooked over 100 degrees centigrade under 4 minutes, the virus, it has eliminated the virus. But what happened thereafter is the cross infection that can render such food infectious. Curtailing it now has to do with concurrent washing of hands after visiting the toilet, before eating, and make sure all the foods are well cooked. And like one authority said, then you have to take your food hot.
The most important one is the one done at the community level, which is to try and ensure that every possible means by which this disease spreads around is impeded, it's stopped. So we try to counsel the relatives of the patient that comes in to watch out for the kind of water they use in cooking, kind of water they use for their normal household uses. We also counsel people to stop eating food outside, because all these local restaurants, we are not sure their mode of cooking, how hygienic the whole process is, where they get the water for cooking from. So we also counsel them to stop eating.
According to the latest NCDC advisory, people of all ages living in places with limited access to clean water are more susceptible to cholera. It's noted that people living in areas with poor sanitation and poor hygiene, slum areas where basic water or sanitation infrastructure is missing or do not perform hand hygiene are also at risk.
Mainly hygiene. If appropriate hygiene is put in place in a way that sewage is properly disposed, in a way that our hand-to-mouth mechanism is effectively clean, in such a way that things that are coming from the from the toilets, from the dungeons, doesn't really get in contact with us. So basically, it's mainly about hygiene.
Had it been that there is a clean source of water for use at the community level, then it will have reduced the spread of the outbreak, because it's very unlikely for this to happen in areas that are, that have nice that has good water system, that people they are wealthy enough to be able to afford healthy lifestyle. These outbreaks tend to occur more in slums, where people are not financially buoyant, when they lack access to good water.